Eliza Joy D. Bondoc, 22 years old from Angeles City, Yermutianong, Pilipinas, Pampanga, Miss CSA Medical Aesthetics Clinic. My main concern is my double chins, and now that I'm here in CSA Medical Aesthetics Clinic, I am about to achieve say goodbye to this thing and say hello to a more slicker and defined jawline. Nalaman ko po sa CSA Medical Aesthetics Clinic when I joined Mutiana, Pilipinas, Pampanga 2023, and during that journey, nakikita ko na sa CSA Medical Aesthetics Clinic through social media platforms like YouTube and Facebook. So nakapag-inquire din ako before, and naka-receive naman din ako ng answer. So now that I am here, I am glad and thankful na I am the Miss CSA Medical Aesthetics Clinic.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. Let's welcome Joy Bondoc. Hi, Joy.
Hi
Right.
Doc.
Yeah. Joy is just 22. Okay, she's very young, and actually, it's not an anti-aging treatment. We're doing a so-called more of a beautification, and we would like to highlight features of the face for young individuals like Joy, of course. Now, Joy is still like in her early 20s and she's still suffering from some acne, okay? Plus, she's studying, what's your course again?
Business Administration.
Yeah, and she's doing a thesis, sleepless nights, right?
Yes po.
There you go. So, lack of sleep causing some acne or breakout, okay? And of course, we're doing a treatment for Joy regarding the acne problems. But that's not our topic, okay? Our talk will be more of how do we like reshape face in a natural and non-surgical way. And the thing is, we Asians are known for having round-shaped face.
Yes.
Bilog daw tayo, right? But
Yes,
it
po.
makes us cute. We have a petite face, okay? Although, when it comes to like the vertical dimension, it's more of a shorter length, okay? Vertically. But horizontally, we're wider. That's why it's like a round-shaped face. And most of the Filipinos that I like take what they call that treat in my center, they kind of have more volume on the mid-face area. So Asian face, round shape, kind of like wider horizontally or the bizygomatic width, but shorter when it comes to the vertical dimension, right? But Filipinos, Asians would want to have like a Caucasian-shaped face because a Caucasian-shaped face is kind of elongated vertically and narrow horizontally, sexier, okay? And kind of you see some of the zygomatic bone structures there. And ideally, okay, female shape or female face shape should be an oval shape. That's the ideal face shape for women, okay? It's different for men. Okay, it's like an inverted egg, okay? Or oval, or we say oblong, okay? Now, we Asians, actually, we have like a shorter lower third of our face. If you do a measurement of the so-called rule of thirds, the upper third, the middle third, the lower third. So, three divisions of the face. When we examine the lower third for Asians, for Filipinos, it's kind of shorter. Kind of like our mandible bone is kind of shorter. Okay? And when we age, it becomes shorter. Okay? Aging also will make the lower third, specifically the mandibular bone, kind of becomes shorter. Kind of like, because there's a bone resorption when we age. Okay? So there's a shrinking of the bone and then it's becoming shorter, and then there's the recession of the chin area. So it becomes inward or it will lack projection. So ideally, we should have this so-called Ricketts E-line for the chin when we check on the profile view, okay? So today, we just want to do like a reshaping in a way. It's still natural. It's still gonna be you. Plus, we just wanna help the lower third of the face be emphasized also and balance it within that proportions, rule of thirds, 1, 1, 1. So we will follow those basic measurements. We'll follow those ratios and proportions. We'll show you when CSA Medical Aesthetics return. And we're back. So we're doing a treatment for joy, more on the lower third of the face. Okay, so when you say the lower third, it starts from the subnasal region here to the, here you go, to the lower lobe of the ear. Okay, and then so we'll be working on, okay, on the posterior aspect. We have here the masseter area here. We'll palpate the masseter. Anterior border will be this part here. Clench, please, Miss Joy. Yan, bite. Okay, so this is the anterior border, and then this is the lower border and the posterior border. So on the lower third, we also work on the masseter. So if we have masseter hypertrophy, we relax it with so-called botulinum toxin. Okay, and then when we do injections here, there are several points for injection. I'll be using the so-called 3-point injection. Okay, sometimes we use 5-point injections or even more than that. Okay, but avoiding, of course, 1 cm of the anterior border of your masseter, so that we don't, like, diffuse the product into our so-called risorius muscle that is attached to our anterior border of your masseter. Okay, so this part here, I'll be working on the masseter using my botulinum toxin. Now, anterior to that, this part here, we have some jowl tissues here, some superficial fatty tissues here. Okay, now there were concerns like about when you inject masseter here. They were saying like, so when you slim this, reduce this, what's happening, there will be dominance of the anterior aspect, the anterior soft tissues here. And when they become dominant, it creates this so-called marionette fold there. It's kind of like becoming saggy, or it will lead to jowling. So those were the concerns, okay? So what we will do is also work on this anterior aspect here, the soft tissues here, the fat tissues here. We'll target it with either a lipolytic solution, or we can use our Ultera device, our HIFU device, to target the subcutaneous fat layers to reduce them. And then we also use our V-leaf threads, PDO threads, to tighten and firm the skin to prevent that sagginess or jowling whenever we reduce the size of the masseter. Okay? Now, when we go into the center of the face, okay, so lower third center, what we're working on is the chin area here. Okay? So what we also have a measurement we call the 1:2. So 1 here, 2 here. That's the ratio, okay? So we want our chin to kind of like be within the 2 measurement, okay? So if you look at that, okay, so we just wanted to somehow lengthen it a bit, improve the vertical dimension so that it doesn't look short. Plus, for women right now, we want to have the chin apex, okay? That's why we want the V contour. We want it to be prominent here in the chin apex and still kind of a rounded shape on the chin area. Unlike men would want square, okay? Women kind of would want the rounded and tapered or sexier chin. Okay, so for this part, we'll be using our hyaluronic dermal filler. Okay, now as injectors, when we work on the face, we want to avoid vascular tissues. Like for example, here we have the anteguinal notch here. We know we have an artery that comes out, branches off to your inferior and superior labial artery, and also to the nose area, gives off lateral nasal to the angular vessel there. So we avoid this. We don't want to touch that. So there is a certain layer where you have your facial vessels, then avoid that certain layer. Okay, so that's for the vasculature. And also facial nerve comes out here. We have 5 branches, one that's gonna go up to the temple region, one that's gonna go to the zygoma, one that's gonna go buccal, one that's gonna go mandibular, and one that's gonna go this part here, the cervical part here. Okay, so injectors, we are very aware of all those anatomical structures, and we have to avoid them for safety reasons. Okay, that's the review, assessment, and anatomy. Okay, as to the procedure, okay, I've mentioned already that I'll be using botulinum toxin, some Ultera, some V-leaf threads, some dermal filler. I'll be working on the right side first. We'll work here. And then I'll be starting with my device. So before doing injections, I have to start with the machine, the Ultera device, so that I can already work on the soft tissues in the anterior aspect. So I'll just be working here the anterior aspect, okay? So we'll place the gel there. Can you disinfect the area? So this is my transducer here. So you can target subcutaneous layer and you can target the dermis layer, okay? So we'll start with our few shots here. This is just a quick treatment. Is this your first time to have this Ultera, Joy?
Yes po, Doc.
Okay. So I'll be doing some shots. How's that? It's good, right?
Yes.
So again, the goal of this one is to prevent any sagginess on this anterior aspect whenever we do the injection of our masseter muscle with botulinum toxin, okay? So we want to target subcutaneous fat, reduce a bit, and at the same time, target your dermis layer to stimulate collagen formation. So we're telling our fibroblast cells to be activated and synthesize those newer collagen, newer elastin, okay? So this is a needleless treatment. So no pricks, actually no needles, though you kind of feel some tiny pricks, right? And there's a certain heat, certain temperature, okay, to induce a subthermal coagulation. So usually when we use those ultrasonic devices, we wanted like a 50 degrees Celsius to induce that effect of neocollagenesis, okay? And this one will gradually take effect. So like actually even after the procedure, you'll feel some tightening already within those tissues. Then weeks later, you'll still see more improvements, okay? So we're working on the right lower third anterior aspect and targeting more of the jowl tissues, the superficial fatty tissues, and we want to also target the dermis layer or layer, a second layer of the skin, okay? So after the epidermis, we have the dermis. So we're just giving some few more shots here to help with our tightening of the jowl tissues. So we can deliver like 30 to 40 shots for this certain specific area. That's a good thing with the Ultera. You can work on specific anatomical parts of the face. Okay, for some people we use it for the entire face. Okay, now I'll proceed with the injection of my botulinum toxin. Okay, this is to relax our masseter, so disinfect the area. Okay, so there are cases I start with 20 to 25 units depending on the size of the masseter. Okay, that's 4 and 6. Okay. Expect some pinpoint bleed from the injection. That's 12. And the final one here. So this one will relax your chewing muscle. Okay, Joy?
Okay po.
There you go. Now, some of my patients, I tell them avoid like chewing those, for example, nuts or hard to chew food or like steak or those meat, okay? Just to slim or reduce the size of your chewing muscles, okay? So after that, we can actually, okay, work also on this jowl tissues here. Okay, I have a so-called some of our PDO mono or screw type of threads. Okay, again, my goal is to strengthen this part here to prevent jowling. Okay, so there you go. So Joy has high tolerance, so inserting those PDO screw type of threads. Screw type of threads are stronger in terms of stimulating collagen, and this will help also in the strengthening of the skin tissue layer. Okay, now next, let's proceed to the chin part. Okay, I'll be using our hyaluronic dermal filler. Again, our dermal fillers made of hyaluronic, they're natural. You see them in your system, in your body, okay? So what I'm gonna do will be a combination technique for her actually. I want to also kind of reshape the chin, make it like, of course, a little bit of an elongated one, vertically, in the vertical dimension, kind of increase that part there. Okay, so we have the needle method first. Okay, for the needle method, you can directly just inject the chin apex. Okay, so chin apex here, okay, center, and then into the, there you go, it's already the apex. So we really need to give volume in this part here. Just push a little bit of our product material. So this is a high G prime viscous material. So whenever you inject it, there's like an extra effort, a lot of effort to push this hard gel into the tissue layer here. Okay, we'll start with a little bit there. Then I want to combine it with this so-called cannula method, just to be able to reshape. Okay, so I want to add with the cannula. Actually, with just the cannula, you can just do a simple technique of like placing it here and placing it there. And then I need an entry point with a gauge 21 needle. Okay, so entry point, kind of like make a diagonal line from your corner of the mouth to the mandibular border there. Okay, just prick there and make that entry point. And I have here a short cannula, gauge 22. Okay, and then we're just gonna glide into this area here, and we'll be doing this so-called technique there, just delivering your product material. Again, I'm using a high G prime hyaluronic substance. Okay, so we expect some rather resistance here, because the mentalis muscle and the skin in the mentalis region kinda they adhere over time. So we sense this strong connective tissues here, strong adherence of the skin to the muscle, because there's not much of a subcutaneous layer. We want to cushion, we want to just improve that and deliver enough amount here. There you go. So we're almost done with filling in the deep sulcus here, or the so-called labiomentalis sulcus. Then let's proceed to the left side. We have done the lower third procedure for Joy. We'll show the result when CSA Medical Aesthetics returns. And we're back, so we'll show the result to Joy. Joy, here's our mirror. Check on the result of what we did, okay? So we had done the Ulthera, we had also done masseter injection with botulinum toxin, some of our PDO Ultra V threads or V-leaf threads, and also the chin enhancement using our dermal hyaluronic filler. So Joy, how was it? Okay.
Sleeker.
Correct. Yeah. You already noticed an instant result actually, and it's really natural. Kind of it balanced, it blended well with the upper and the middle third of her face. Okay. Feminizing the face and improving the shape of the face. More of a feminine type of shape of the face. Right? Yeah. I like this one, the chin.
The chin, yes.
Yeah. It's so natural. It's so feminine. It's sexier. Okay. Although with the botulinum toxin injection of the masseter, we're still waiting for the outcome or the result for about 2 weeks, okay? And same thing with the Ulthera. We did the Ulthera here. Actually, it's working 4 weeks, 8 weeks, 12 weeks. Neocollagenesis happens in 12 weeks time. And then also those V-leaf threads, those threads that we inserted, like on a diagonal and parallel pattern, they will also work. Neocollagenesis also in 12 weeks time. So it's kind of like a gradual process. 1 month, 2 months, 3 months, you're still seeing that better outcome, like an improved jawline area and lower third of the face, right? Plus the chin volume filler or the hyaluronic filler, it attracts water. It will further volumize, and it's still gonna give that a better looking chin. Okay, so was it painful during the process?
Slight lang po.
Yeah.
Pero I'm,
So
high
tolerable.
tolerance naman po
Yeah.
kasi.
I noticed nga eh. Because, of course, with the injection here, the botulinum toxin, tiny needles only. Okay?
Yes,
You feel the insertion of the needle, but so far so good,
Tolerable.
okay? It's tolerable. And then the Ultera, kind of tiny pricks, a sensation of like there's a heat sensation there. And then also with the threads, the PDO threads, of course, we have needle there. And then here we combined cannula here, and then here needle method here. So I smoothened the sulcus here, the labiomentalis sulcus here, and then did the chin injection with filler direct on the apex there. So kind of you sense a bit the needle,
Yes, po.
but so far it's tolerable, right?
Yes,
Okay.
po.
So this is like enhancing the lower third of the face, and at the same time preventing aging. Okay, I also don't want you to develop a marionette line here, and I don't want your corner of the mouth to downturn. So you just want to improve all those tissue layers there, the mandible part there, and enhanced and beautiful to more beautiful joy. There you go. I love the smile.
Thank you so much.
She's so charming. She's so pretty. Okay. Yeah, actually she was she joined the beauty pageant, right?
Yes.
And you were like, you had a, what do you call that? You were one of the winners, right?
Yes po, but
Yeah.
only in top 10.
Oh,
Top 10
that's something
finalists.
already. That's something I can
Yes, something
also
to be proud
achieve.
of, yes.
Yeah, that's your achievement. Me, I don't have that. So you should be proud of yourself, and congratulations on that one. So happy for you and proud for you. Hopefully, you're gonna still have more beauty pageants in the
Hopefully
future.
po.
Yeah, because she's very intelligent. I think when it comes to the question and answer, she's brainy. Okay, she knows how to do the Q&A. Sample Q&A. Anyway, Joy, thank you so much. We're so
Thank you
happy
so
to have
much
you
po.
here, and we hope that we'll be able to still help you more with further enhancements. I was also looking at the mid-face section. I was recommending also some nose enhancement, okay, just like a nose line or nose contouring, and then also some lip contour, lip enhancement, all of those. Non-surgical in a natural way. Thank you, Joy. Thank you so much.
Thank you so much
Yes.
po.
Do you have any social media that they can follow or check on you?
Well, you can check me on my social media platforms on Facebook and Instagram, Joy Bondok po.
There you go. Thanks, Joy. And if you have any question, you may also email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our videos in our YouTube channel, Contessa Salvador. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.